talking about safe kids. Dr. Brown, tell me the importance of immunizations.
Immunizations are probably the most important thing we do for children. I think they're clearly the most impressive medical advance of the last 100 years. So many children used to die of childhood illnesses that we don't even know about now. Many people haven't seen.
I know a lot of people said, they'd have 9 kids so that maybe, because several of them would die. Is that true? Yes.
Right. Illnesses like measles, I've only seen 2 or 3 cases of measles my whole career. And that's because of immunizations. And now it's happening with chickenpox. People used to know what chickenpox looked like. Everybody knew what chickenpox was. And now many young mothers have never seen chickenpox, haven't had it themselves maybe, or certainly haven't seen it lately. And so what it does is it takes a lot of these illnesses that used to be a major problem and reduces their incidence and reduces the complications that come from them.
And how many immunizations does usually a typical child between, the ages of newborn to 2 get?
Between the ages of, between a newborn and the age of 2, a child who received all of their immunizations, including a couple that are optional, would get 19 immunizations. And 3 of those would be oral immunizations.
And how important is it? I mean, we all think about, okay, now that most of these diseases are obsolete, how important is it for, someone to come in and get immunized since they're kind of, weeded out?
Yeah. Well, that's a good question. There are a lot of these illnesses that are not obsolete at all. In fact, most of the vaccines we're immunizing for are illnesses that people still get. In fact, I had a baby who had one of the vaccine preventable illnesses just a year ago, and who almost died.
So still very important.
Yes, very important.
Tell me a little bit too about RSV. I know that happens a lot during the winter months, and they haven't come. There's not a vaccine for RSV.
RSV is a very common illness, and in fact it's common for people of all ages, but it really is a problem for children under 2 because they're the ones who can have respiratory problems that can be life-threatening from it. There isn't a vaccination in the traditional sense, but there is a vaccine that is a passive vaccination, which means that if they get a shot every month during the season, it can prevent the illness. That vaccine is recommended only to children who were born prematurely.
I see. So tell me too, like if somebody gets flu-like symptoms, what are the signs of RSV maybe? Or, if you have a bad cough, what would a parent say? Okay, this one might be just a regular cold, but this one is definitely something I need to take someone in for.
Right. So all winter we're used to our children having runny noses and coughs and even fevers, and hopefully we're not too worried about that. But you're right. If we have a child who gets a high fever, we want to see them for sure. And specifically when it comes to RSV, some of the things that we watch for are children who are coughing more than average. And when they get into trouble, they begin to have real respiratory distress. And that can be just looking at their child and saying, man, that child is really working hard to breathe. Or a child whose nose flares open with each breath, a child whose ribs stand out when they breathe, or a child who's under a year or a year and a half of age that's breathing more than 60 times per minute. Any of those children are beginning to have signs of respiratory distress, and we should see them.
And what are some other things for like flu-like? I know that influenza is now going around. My kids lovely caught it, of course, but tell me some of those signs and what to do and how to help just alleviate some of the the hardships that it causes.
Influenza is really coming up right now. We're seeing a lot of influenza lately, and those symptoms are usually a fairly rapid onset of a respiratory illness, runny nose, dry cough, fevers, often in the 102 to 105 degree range, headaches, achiness throughout their body. And those kids will usually be sick for 5 to 7 days and be pretty sick during that time. There is a medicine that helps a little bit if it's caught in the first 24 to 48 hours, but beyond that, we're just doing symptomatic treatment.
And what are some of those symptomatic treatments?
Tylenol or Advil for the fever and for the achiness. Plenty of fluids to keep them hydrated, although they won't want to eat much, as long as we're focused on making them drink enough that they'll be hydrated.
I know, because it's hard to get your kids to drink something like Pedialyte.
Yeah. Well, and in this situation, it doesn't matter. Whatever they'll drink is okay. Pedialyte's really valuable for children that are vomiting, but in this situation, it's mostly respiratory, and so if it's liquid, it's going to help them.
Definitely, for sure. The other question we had was, we're in the immunization room in the Budge Clinic. Yes. So you guys have a special place where you get to hear lots of screaming children. Exactly. Do you see a lot of kids in here?
Yeah, there are a lot of children that come and get their immunizations in this room.
And do you get to do that? You have your nurses. You pawn that off. You don't get to be the bad guy.
Lucky for me, someone else does that for me.
Exactly.
Right.
And let's see. There's plenty of immunizations given over a lengthy time, but is there something that you specifically think that parents should always get their kids no matter what? Out of all of the immunizations, if you had to elect one, obviously you give them all, but what would be the most
Yeah,
important?
well, I would say there's a group of most importance, and those would be the immunizations for pertussis, the immunizations for meningitis, which are Prevnar and Hib, and probably the immunizations for measles are probably the most important vaccines if we were going to choose among them.
Well, you're definitely, I bet you're really great with kids.
I hope
You're not going to toot your own horn. Well, thank you so much. We're here at the Budge Clinic for the pediatrics. Dr. Brown, thank you so much.
Thank you.